Hey guys, it's Dr. Courtney from Durrum Chiropractic and Family Wellness. Today we're going to talk about low back pain and just how big of a problem is low back pain. Well, I'll tell you, it's a huge problem. The research shows that 50% of Americans will suffer from low back pain during their lifetime. In fact, at this very moment, 35% of you, that's 1 in 3 of you, are currently suffering with low back pain. So yeah, it's a big deal affecting a major portion of our country. Now, what about the cost of low back pain? You're really just not going to believe the expense and the cost of low back pain. Research shows that $50 billion per year is spent treating low back pain. That's a crazy number, but that's the direct cost, medical expense of low back pain. The indirect cost of low back pain is more than $100 billion. That's crazy, okay? This is the indirect cost that's also called presenteeism. This is where employees are showing up for work, they're present, they're doing their best to do their job, but either because they're suffering from low back pain or maybe they're under the influence of some sort of drug or medication to treat their lower back pain, they're unable to perform at 100%. That's known again as presenteeism, and we don't want that for you either. Now, we also know that many folks, when they're suffering from low back pain, will reach for some sort of drugs or medication, opioids being one of those. And we all know how costly this opioid epidemic is in our nation, not just in the dollars, but in the quality of life and the relationships that are lost due to these just terrible opioid addictions. And keep in mind, opioids aren't getting to the root cause of the problem. They're simply managing the pain so that you can continue on some level to function on a daily basis, but certainly not functioning at 100%. Now, one of the other treatments for lower back pain is often surgery. And the research studies show that when you're suffering from low back pain, an acute incident of low back pain, and the first physician that you see is a medical doctor, in 20% of those cases, you end up in surgery. Now, on the contrary to that, those who are suffering from acute low back pain that actually seek out and find a chiropractor to take care of their problem with the lower back pain, less than 5% of those end up in surgery. Now, in our office and our clinic, and I've been practicing for over 20 years now, we've seen over 6,000 individual people, only 3 of those. So that is less than 1% of the people we have ever seen in the last 20 years have ended up having to resort to some sort of low back surgery. And in all 3 of those cases, these were people who had been suffering for decades, had neglected to take care of their spine, their nerve system, and it had eventually deteriorated to a point that the low back surgery was actually necessary. I'm also proud to say that all 3 of those people, even though they did have to resort to surgery, are now currently under care because they understand that by taking care of the spine, taking care of the nerve system, and being proactive moving forward, this can help them actually avoid any future surgeries, because they certainly don't want more surgeries in addition to that. Oftentimes surgeries are unsuccessful and those folks continue to suffer, or they have repeat surgeries after that. Okay, so we would like to avoid that if at all possible. All right. If you're interested in our office with chiropractic care, we like to get to the root cause of your problem. Find out what's actually causing the problem. We know that could be something with your lumbar spine. It could be the sacrum, the ilium. It could even be a lumbar disc. And many folks don't realize that with the current techniques and tools that we use for adjusting, treating lower back pain can be really gentle, can be a very easy process, and just wildly successful. We'd love to check you out, see if quite possibly there's something that we can do to help you and help you avoid these other avenues, but most of all, help you get better outcomes in the future. We want to see you get back to living the life that you love. So click on the link below. We have a link below that'll take you to a new patient special where you can get in. We'll do an exam, consultation, x-rays. We're going to get to the root cause. We'll let you know whether or not we can help you. I hope to see you soon.